Hi everyone and welcome to Bounce Back. Today we're going to go over some exercises that are great for anyone who's suffering with foot drop or sometimes called drop foot. So for this workout or for this session you don't need any equipment apart from a resistance band or a towel that you can use instead and a chair, because I'm going to do some of these exercises seated. So to start with I'm just going to use the band or the towel and wrap it around one of my feet. And then this is just called plantar or dorsiflexion, so it's just pointing and flexing the foot. So with the band around my foot, I'm just going to be coming forwards. So you're working the muscle there and then backwards, controlling it slowly backwards until you feel that stretch down the back of the leg. And then if you go for 10 repetitions of this exercise on the same foot. So nice and slowly, nice and controlled. You can do this one seated on a chair or on the floor as well. Four more. And last one. And then relax that foot. And then go the same on the other side. So again, going for 10 on this side. So pointing your toes to the ground as far as you can. So it's good, always good to do both sides, even if you're just suffering with drop foot on one side, which is most common. But good to practice both, and you can always go back and do an extra set on the foot that is finding it most difficult. So even if there is very little movement, it's still a really good one to practice to maintain that strength around the ankle and in the calf muscles. And using a towel is exactly the same, so same movement, but you've got a little bit more resistance there if you're using a towel rather than a band. And then once you've done 10, you can relax there. And then next one is going into ankle eversion. So still using my towel or my band, wrapping it around my foot. And then this time going outwards with the foot. So aiming to get the toes pointing towards the wall over and to my left, and then back to the middle. And again, going for 10 on each side. The main thing to think about here is keeping your knee still. So if your foot is struggling, if the muscles are weak, then the knee is going to want to come in to cheat and to come with it. So it's going to turn to the left. But keeping the knee still is forcing those lower leg muscles, so the muscles in the calf and ankle, to work rather than the muscles in the thigh. So again, this is another one you can do either seated on a chair or on the floor. Okay, and then once you've done 10 on that side, switch over and go for 10 on the other side. So nice and slowly and controlled. Make sure you've got the band in the right position, and then out and in. I'll show you from the side so you can see this from the side as well. So knee is staying straight, toes coming out and then in. Might get a little bit of clicking as well in the ankle. As long as that's not painful, it should be fine. Okay, and then relax there. Going back again to the other side. And similar movement, but this one is going inwards rather than out. So ankle inversion. So coming in, controlling it in, and then out. So depending on where the weakness is, one of these movements might feel much more difficult than the other. And if there is one that is particularly difficult, you can always go away and continue to practice that one. So without going through this whole video over and over again, you can just focus on the ones that you know are most difficult to perform, because that is probably where the weakness is. So hopefully you're feeling it all around this area of the lower leg. Nice and slowly, nice and controlled. Okay, and then when you've done 10, then switching to the other side again, so 10 more on the other side, knee staying straight, so you can even hold your knee if that helps, or hold the upper leg, so you remember to keep that part of the leg straight. Okay, so when you've done 10 of them, then you can relax again. I'll just go for 2 more. Okay, and then relax there. Our next exercise is again either using a towel or the band. I will continue to use the band. You might find this one helpful to take your socks off just so you've got a bit more of a grip. But what you are trying to do, and you can separate the legs here, so you can either do one at a time or you can try and go together. But what you're trying to do is just lift the towel up off the floor or the band up off the floor using your toes. So you're scrunching them up towards the band and then releasing. So towards the band and release. So if you're doing it with one foot, you can have a go lifting it off the floor like that. So another way you can do this one as well is with marbles. So if you put a marble onto the floor and you try and lift the marble up with your toes. So it's quite difficult with socks on, so you might do better at taking them off, but I'll keep going with my socks on. Because as long as you're doing the movement and it feels challenging, then it's the right thing. You're still working those muscles. So don't worry if you can't lift the band up or can't lift the towel up too high. And once you've done 10 of those, we will move on to the next exercise. We'll go for 2 more. Go for that one-legged one again. So really aiming to lift the towel up. It's probably also easier with a towel rather than a band. Okay, and then relax. So next one, I will move the band, don't need that anymore. Got 2 standing exercises now, and the first one, you might want to hold on to something for this. So I'm going to move the chair forwards onto the mat. And I'm going to hold on to the chair with one hand. And this is just a one-legged stand. So if you just practice standing on one leg, and then you can challenge yourself by just letting go with, first of all, one finger, another, until eventually you can take your whole hand off if you want to practice holding on with doing the one-legged stand without holding on. So really challenging your balance, squeezing your glutes to help you control this. Keeping your belly button drawn in so your stomach muscles are strong and engaged. If you fall down, just relax for a second before you come up and start again. So aiming for about 30 seconds and then relax and then have a go on the other side. So again, use something if you need to hold on, or you can have a go without holding on. And again, this is another exercise that is really good for strengthening the calf muscles, so muscles in the back of the legs. And when you're doing this, you just want to always make sure that you're not rolling in too much. So I'll show you from the side. You don't want to roll in, so that would be a flat foot, and that is what your drop foot is causing. So when you're doing this, you want to keep your heel pressed down into the floor, and your toes pressed down into the floor, so you're maintaining an arch in the foot. Okay, and then relax on that side, and then we'll go back again, so back again to the first side. If you want a more challenging exercise than the one-legged stand, if you're okay with this, then what you can have a go doing is just gently leaning forwards to the centre, to the side, to the centre, and to the other side, and centre. So just challenging your balance slightly more and reducing the stability under the foot, but always focusing on that arch. So toes press down into the floor, heel press down into the floor. Okay, and relax. And then same again on the other side. So again, challenging your balance. And then you can have a go if you want to. You can do this holding on to something too. So forwards, to the side, and to the other side. And when you're doing this balance, if you focus on something still on the floor, that helps a lot with controlling that movement and not falling down. Okay, and then relax there. One more exercise to focus on for improving the strength in the lower leg and preventing the problems caused by foot drop. And this is a calf raise, and I like to call this the bounce back calf raise because it's a gradual progression. So to start with, either holding onto a chair or a wall, and you can start with your feet quite far away from the chair, and then you're just going to be rolling forwards, so from heel to toe, up and down. So the further you are away from the chair or the wall, the easier it will be. And hopefully you're feeling this in the calf muscles, down the backs of the legs, up and down. So if there's a lot of nerve damage in the leg and a lot of muscle weakness, then this is going to be really challenging right here already. So just stick with this level, stay away from the wall, and keep your hands, so if you're on a wall, you can keep your hands higher up. That will make it easier. If this is easy already, you can take a step in and come into the wall, and if you're or onto the chair, and if your hands were higher up, then just drop them down the wall slightly. So the closer you are, the more weight there is going through onto your toes. So it's going to be more challenging. And again, if that's really easy, you can take a step in, and you can even have a go without holding on. So just doing a normal calf raise, up onto your toes and down. And if you want to focus on that one side, then that is fine as well. You can go back to the start and you can just think about that movement just coming through the left leg if the left side is weaker, or the right side if the right side is weaker. But there you go, that is those are 5 exercises to help anyone who is suffering with foot drop. I hope you enjoyed it, and please check back again on my channel to see more videos to do with mobility, movement, strength and balance. But thanks for watching.